Thanks for staying with us. High-risk pregnancy impacts 6 to 8% of all pregnancies, and CMU Health maternal fetal medicine specialists play a crucial role in reducing risks and offering comprehensive care. Joining us this morning to tell us more, we have Dr. Jennifer Caruso. Appreciate you being here, and we want to start with the question of describing your role as a maternal fetal specialist, and also tell us what makes the specialty different from a regular OBGYN.
Yes, thanks for having me. So high-risk pregnancy does impact a lot of pregnancies. We as subspecialists see and focus just on pregnancy. So OBGYN, they play a huge role in women's health, pregnancy, but also just women's care. Our specialty focuses really on the pregnant patient and also the baby. So we spend time focusing on mom's health and baby's health. We can have 2 patients at least with every pregnancy and every patient. So we spend time working with moms, kind of diagnosing if they have any medical conditions and teaching them about their chronic conditions. And then also the babies, using ultrasound to find babies' conditions if they have any, and then the whole pregnancy. If there's complications with the pregnancy in and of itself, making diagnoses and creating treatment plans.
Well, let's go back to that. You talked about complications. What are some of the type of complications that you see, and how is CMU Health and your team really managing that?
So really common complications are things that are common in the population. Obesity, diabetes, blood pressure. But pregnancy complications could be things like high blood pressure in the pregnancy or diabetes in the pregnancy, problems with the placenta. We also do, complications with baby. So if baby has an abnormality or a suspected abnormality on ultrasound, we use ultrasound to make a diagnosis. Also genetics, that's another complication. If there's something going on with the ultrasound, using, our ultrasound findings to maybe offer an amniocentesis or other genetic testing that might help us to learn more about the baby.
And with technology today, is that more possible?
Absolutely. So we can make lots of diagnoses with ultrasound, different problems. Of course, learning if a mom has more than one baby, of course, that's one of the things we use ultrasound for. But we also use it for learning about if the baby's size is normal, either too big or too small, if there might be something going on like a birth defect, a heart defect, and then making sure that we teach the parents about what those findings are, and making sure the patient then is in the appropriate situation to have a healthy pregnancy, either with us here or at a tertiary center.
Well, are there health steps that you can take before and during pregnancy to hopefully make sure your baby is as healthy as possible?
So the biggest things we can recommend prior to pregnancy are checkups, regular checkups with a primary care physician, making sure that health conditions are well controlled prior to pregnancy. So diabetes that's well controlled prior to pregnancy, or high blood pressure that's well controlled. If a mom is obese, some weight loss prior to pregnancy. Those things can make a huge difference with pregnancy outcomes, making sure that we have a healthy mom and a healthy baby at the end of the pregnancy. As well as we offer preconceptual consultations. So if a mom has those medical conditions prior to her pregnancy, she could come see us prior to help optimize her health so that we can decrease the risk for her and the baby during the pregnancy.
Oh, wow. I didn't realize that was something that they do. That's great. Now, what can a patient expect during her visit to the maternal fetal medicine clinic?
Yeah. So most patients, if they are pregnant, will have an ultrasound in our office. It's generally an ultrasound looking at baby from head to toes, making sure all of the structures are nice and normal. During that ultrasound, we usually will check baby's size, making sure that baby's size is not too big or too small. And then at the end of that visit, or even during that ultrasound, one of the physicians would come in to talk with the mom and the parents about what is going on during the pregnancy, either her medical conditions or the ultrasound findings, going through an extensive visit to go through her history, and then talking about what we find and what our recommendations are, any follow-ups that we might have during the pregnancy.
And is that the basic way that you and the CMU Health team really help navigate this? Because there's a lot that goes into this.
There is a lot that goes into it. So in our visits, we kind of start there. Also asking the parents and the families if they need any resources. You know, if there are major complications or there are major concerns during the pregnancy, we have at CMU social workers that can help guide us. We have Centering Pregnancy that can help us with making sure that we have adequate prenatal visits. And then, you know, using our local resources. If we have diabetes in the pregnancy, we have diabetes education that can help a family, you know, with learning about diabetes and what foods to eat, what foods to avoid. All of those resources, you know, we help get the patient plugged into wherever we might need.
Oh, so much information. Well, we appreciate it, Dr. Jennifer Caruso, CMU Health. Remember, too, you can always find more details and some connection links by going to Hot Links, and that's at the top of our homepage at WNEM.com. Thanks for being here.
Thank you.